Okay, so good afternoon, everyone, and welcome to our inaugural session. We are so pleased to have you join us for the launch of our six-part series, A Targeted Approach to Reducing Environmental Cancer Risks in Pennsylvania. We are kicking off this series with our first session, The Clinician's Role in Environmental Health Assessment. My name is Danny Wilson, and I'm honored to be your host for this series. I serve as the Executive Director of the Cancer and Environment Network of Southwestern Pennsylvania and as a co-chair of the Environmental Health Work Group with the Pennsylvania Cancer Coalition. This entire series is a co-hosting effort between these two wonderful organizations that I'm honored to represent. First, we have the Pennsylvania Cancer Coalition's Environmental Health Work Group. Our primary and central objective is to strengthen public protection from environmental carcinogens and cancer risk factors. Second, we have the Cancer and Environment Network of Southwestern Pennsylvania, a network of over 50 organizations dedicated to eliminating harmful chemicals in our environment that contribute to cancer. The partnership between CENSPA and the PCC is especially significant right now. The Pennsylvania Cancer Control Plan includes specific environmental health goals for the first time ever, making us one of the first states to incorporate this crucial focus. This landmark inclusion reflects the success of the collaborative efforts driven by groups like ours. Now, let's turn our attention to today's speaker and the topic that launches our entire effort. We are so fortunate to be joined by Dr. Ned Katayer, President of Physicians for Social Responsibility, Pennsylvania, for the critical topic of the clinician's role in environmental health assessment. Dr. Katayer will guide participants on how to integrate environmental health history and risk assessment into routine clinical practice, connecting common environmental exposures to specific health outcomes. This is essential, proactive information for every healthcare professional. Dr. Katayer, thank you so much for leading our first session. The floor is yours.
Thank you, Danny. Thank you, Andre. And thank you, everybody, for joining us today. Let me just share my screen. And if you could just let me know, can you see my slide?
Yep.
Very good. Okay. I'm going to turn all of you off so I don't see you, and we'll get started. Physicians for Social Responsibility Pennsylvania is a statewide nonprofit educating and guiding healthcare professionals to reduce their patients' risks from environmental health threats from fossil fuel pollution, from plastics and petrochemicals, and also climate change. PSRPA strongly advocates for health protective policies at local, state, federal, and even international levels. Environmental Health Project is a public health nonprofit organization that provides a wide-ranging support to individuals and communities impacted by shale gas development, also known as fracking. That support includes health impact assessments, environmental and health monitoring, data and research interpretation, and public health guidance. EHP also engages in policy dialogues at the local, state, and federal levels regarding the plastic health consequences of shale gas and oil activities. And another interesting and important nonprofit group I'm involved with is PSNAP, Physicians and Scientists Network Addressing Plastics and Health. It was formed earlier this year, and it's a national alliance of health professionals, researchers, and public health experts who feel that we already have enough data to act urgently and reduce the growing health risks, including cancer risk, coming from plastics and its chemical additives. PSRPA and EHP work with other partners that you see here in Cancer and Environment Network of Southwestern Pennsylvania to raise awareness among health providers, lawmakers, and the public about environmental cancer risk and risk reduction. And again, you can see some of the organizations involved in CENSPA, groups that are united in the vision for a cancer-free Pennsylvania. CENSPA came together out of a belief that cancer prevention is possible. A large proportion of human cancers are avoidable, and today we have proof that there's power in prevention. For example, we know that one of the most important lifestyle factors accounting for almost 20% of all cancer incidents is smoking. Not smoking and avoiding secondhand smoke reduces the risk of lung cancer and other forms of adult cancer. Reducing UV light exposure and avoiding sunburns by using sunscreen and protective clothing greatly reduces the risk of melanoma and skin cancer. Being vaccinated with the human papillomavirus greatly eliminates the risk or greatly reduces the risk of cervical cancer in women and oral cancer in men and women. Other vaccines also prevent cancer. Hepatitis B vaccine, for example, lowers the risk of liver cancer. We know we can reduce cancer risk by reducing air pollution. We have the opportunity right now to address the climate crisis and transition off of fossil fuels, choosing renewable energy and sustainable ways of living. That's good for our health, for our planet's climate system, and it's good for our kids' future. Radon gas is the second leading cause of lung cancer behind tobacco smoke. We can reduce that risk by testing for radon in our homes and our businesses and our schools, and then use mitigation techniques to eliminate it. There's evidence that exposure to pesticides like glyphosate and chlorpyrifos can increase cancer risk. But there are alternatives for pest control that both farmers and consumers can choose instead. Now, our diet can also raise our cancer risk, but we can change that by reducing and even eliminating red meat and processed meats from our diet, avoiding overweight and obesity, and increasing our activity level have also been shown to reduce cancer risk. Unfortunately, there are many carcinogenic chemicals in many consumer products, like formaldehyde in certain building materials or per and polyfluorinated substances, otherwise known as PFAS or forever chemicals, in our stain resistant carpets, in our clothes, in our food packaging, in our nonstick pans. However, we also know that wherever there are specific carcinogens in specific product types, there are also safer alternatives. We've gotten good at treating cancer over the last few decades, but we haven't done a good job in preventing them, especially childhood cancers and environmentally sensitive cancers. There is one exception, though. Efforts to reduce smoking have resulted in a large drop in lung cancer. Cancer rates in the 7 southwestern Pennsylvania communities or counties are up to 50% higher than the rest of the United States. Bladder cancer, breast cancer, kidney cancer, lung cancer, thyroid cancer, and leukemia happen more commonly here than in other places in the US. And they are all strongly associated with exposure to fossil fuels and toxic chemicals in our environment. Childhood cancer rates are significantly higher in Greene and Westmoreland counties, for example, and they appear to be higher in Washington County as well. All throughout southwestern Pennsylvania, people living in urban and rural communities are exposed unnecessarily to environmental carcinogens. Auto and diesel emissions from our busy highways continue to add cancer-causing particulate matter to the air. Coal mining has declined substantially, but its toxic legacy remains in some of our neighborhoods. Fracking for gas has added a whole new layer of toxic pollution to the air and water of this region over the last 20 years. And it's likely to increase to fuel greater LNG exports, blue hydrogen projects, and energy-hungry AI data centers. And pollution from factories like steel mills that rely on old and dirty coke ovens continue to contribute to the region's often dangerous air quality. Using data from EPA's National Air Toxic Assessment, the results are startling. Allegheny County ranks among the worst 1% of counties nationwide for cancer risk from point source industrial pollution. Nearly 90% of the point source cancer risk estimated in Allegheny County is attributable to coke oven emissions, with about 90% of those emissions coming from U.S. Steel's Clairton Coke Works. Emissions from cars and trucks are also problematic in Allegheny County, ranking among the worst 7% of all counties nationally. Cancer risk associated with toxic air pollutants was 26% higher in Allegheny County among environmental justice census tracts compared to non-environmental tracts. So there are disproportionate burdens from exposure to carcinogenic air pollution among racial minorities and those living in poverty. We know it can be difficult for us to individually to reduce exposure to dangerous emissions and pollution when we leave our homes. But inside our homes, where every room contains potential carcinogens, we do have more control. Each room presents unique risks, but also opportunities to reduce risk. Chemicals in bedroom furniture, like formaldehyde and flame retardants, are known to be carcinogenic. The risk to health can be reduced when homeowners select furniture made without flame retardants and buy solid wood furniture with natural finishes instead of laminated furniture or furniture made from plywood or particle board that contains formaldehyde. In the bathroom, soaps, shampoos, cosmetics, and bathroom cleaning products can all contain chemicals that have toxicity and cancer-causing potential in humans. Phthalates, for example, act as endocrine disrupting chemicals, and exposure can lead to cancer. Fragrance is a generic term used on product labels without actually disclosing the exact substances contained in the product. Most personal care and cosmetic products have a pleasant smell or a fragrance, such as what's in sunscreen or shampoo, soap, body wash, deodorant, body lotions, and perfume. More than 3,000 chemicals are used as fragrances, and some have been found to be linked with cancers, especially breast cancer, as well as reproductive toxicity and endocrine disruption. You can also find carcinogenic hazards in living areas or in the kitchen and in laundry rooms. And then you open the door and you go outside. Uh, so it's important to know your zip code. In other words, identify the human activities around you that can threaten your health and the health of your loved ones. Uh, Industries active in my region of Pennsylvania include the oil and gas industry and the steel industry, and both emit a host of dangerous chemical contaminants into the air and the water and the soil and into the lives of those of us who live here. Fracking is only the most recent industrial source of particulate matter, VOCs, heavy metals, formaldehyde, radioactivity, and more that impact the environment and threaten the health and safety of everyone living here. On a warming planet with ecosystems suffocating from petrochemical and plastic pollution, fracking may very well be a dead end for humanity. But it doesn't have to be this way. Not in 2025, not anymore. Uh, 30 years from now, our children and our grandchildren will live in a world shaped by our choices. We do have choices, but time is running out for us, their parents and grandparents, to make the right ones. But about a little bit more than 50 years ago, Pennsylvania did make a good choice. The Environmental Rights Amendment to the Pennsylvania Constitution was ratified by voters in 1971. And very few states give citizens these rights. Unfortunately, very few Pennsylvanians know that Article 1, Section 27 grants us the right to clean air, pure water, and the preservation of the natural, scenic, historic, and aesthetic values of the environment, not just for all of us, but also for our children and grandchildren and generations yet to come. I think most of us on this call are aware of the social determinants of health, which are the non-medical factors that affect health outcomes. They include factors like socioeconomic status, environment and physical environment, education, food security, employment, social support networks, and access to healthcare. You can see the importance of neighborhoods and physical environments. The zip code where a person lives and works, where a child goes to school and plays, and whether they have access to things like safe housing and access to green spaces and playgrounds. These are really important factors influencing health outcomes, including morbidity, mortality, and life expectancy. For healthcare providers, it's important to assess all of these social determinants of health when taking a patient's health history, starting with learning about your patient's zip code and getting an idea of what environmental health threats are present around them. Environmental determinants of health include physical factors like air pollution and water pollution and impacts from climate change. And also chemical determinants, including the toxic chemicals we all seem to be exposed to daily in our food and water and consumer products, which adds to our environmental health burden. There are many environmental factors that impact human health. Most of the work I do focuses on threats related to fossil fuels and how they adversely impact air quality and water quality and the safety of our food supply, while also accelerating climate change. Tens of thousands of synthetic chemicals, most of them derived from fossil fuels, have become ubiquitous in our consumer products, in food, in the environment, and ultimately in us. PFAS chemicals, for example, those forever chemicals, the per and polyfluoroalkyl substances, they're used in manufacturing, in oil and gas fracking, and in all the plastic products that we buy. Practically everyone who's tested for PFAS has detectable levels in their bodies. These chemicals have a disturbing habit of disrupting our endocrine systems in extremely small concentrations. And they've been linked to increased risk for kidney cancer, thyroid cancer, testicular cancer, and possibly even breast cancer. Plastics pose another public health hazard as they break down and degrade in the environment. We end up breathing and ingesting microplastics and nanoplastics, which have recently been detected in practically every organ that researchers have looked, including the brain, the heart, and the human placenta, which indicates that babies today are being born pre-polluted. Many of plastics chemical additives are clearly harmful, and some of them are known or suspected carcinogens. And finally, we've all been watching the health threats from climate change multiply in the US and around the world, from excessive heat, extreme precipitation, and flooding, damaging storms, droughts, and devastating wildfires that expose the public to toxic air pollution. In my zip code, residents are concerned about health impacts from living near fracking. In 2019, two reporters from the Pittsburgh Post-Gazette published published the human toll. Their reporting uncovered 27 cases of Ewing sarcoma and 40 cases of other rare childhood cancers in four heavily fracked counties in southwestern Pennsylvania from 2008 to 2018. That's a total of 67 rare cancers in children, teens, and young adults in a period of just 10 years. Only about 200 cases of Ewing sarcoma are diagnosed in the United States each year. It's an extremely rare, aggressive, painful, and frequently fatal cancer in youth. In Washington County, where I live, Templeton and Hopi counted 6 cases of Ewing sarcoma and 30 other rare childhood cancers, including leukemia, lymphoma, tumors of the liver, kidney, brain, and bone. All of the county's cases of Ewing sarcoma and 10 cases of other rare cancers occurred in one school district next to mine, the Cannon-McMillan School District. These numbers are far more than would be expected to occur in a similarly populated, mostly rural area over a 10-year period. And new cases keep popping up. Parents and physicians remain very concerned that pollution and toxic waste from fracking operations may be to blame for the high numbers of rare childhood cancers. And the concerns about fracking and cancer risk in children are not unfounded. There are 3 studies in children that I'd like to call your attention to. The first study by Clark and colleagues at Yale School of Public Health found that young children living within 2 kilometers, that's a little over a mile, from a fracked gas well in Pennsylvania, had 2 to 3 times the risk of developing acute lymphoblastic leukemia compared to kids living further away. The second study from 2023 by Talbot and colleagues at the University of Pittsburgh found that children living within a half a mile of a fracked gas well in Pennsylvania had 4 times the risk of developing a malignancy compared to kids living further away. Kids living within 1 mile had 5 to 7 times the risk of developing lymphoma. Incidentally, they did not find a correlation between fracking and Ewing sarcoma in that study. Just this year, McKenzie and colleagues in Colorado found that children living up to 13 kilometers or 8 miles away from a fracked well were at increased risk for developing acute lymphoblastic leukemia. Children within 5 kilometers or 3 miles had the highest risk. The intensity of drilling and fracking on the well pad was assessed as a risk factor, as well as proximity to the well pad. Kids who live closest to high intensity activity, in other words, multiple wells drilled on the well pad compared to just one or two, they had up to 80% higher risk of being diagnosed with ALL. The researchers concluded that the current setbacks may not be sufficient to protect the health of those in children, which is an understatement. In Pennsylvania, the setback distance legally is 500 feet, which is crazy. So, as I mentioned before, maybe the most important determinant of health is your zip code. I live in Washington County, which is the most heavily fracked county in Pennsylvania. Recently, I wanted to get an extent of fracking in my neighborhood. I was particularly concerned about kids who attended the Canon McMillan School District, where that spike of Ewing sarcoma occurred. I opened up my map app on my laptop and carefully marked every fracking well pad and compressor station and other infrastructure site that I could find. I didn't mark the thousands of older conventional wells in the county, many of which are unplugged and leaking, and that we already know are adding to the region's air pollution burden. But you can see on this map just how extensively fracking sites have been built up in the county over the last 20 years. And you can see how close it all is to those yellow thumbtacks in the middle, which those are the Canon McMillan schools. Seeing it from space, from the satellite data that Google collects, it's astonishing. And I live right next door to this. If I ever develop symptoms that I think might be related to fracking, I will definitely show this map to my doctor. All of us are vulnerable to health damage and environmental health threats, but um, some of us are even more vulnerable to the effects of pollution and petrochemicals and climate change. It shouldn't surprise anybody that women and children are at the top of the list. Pregnancy is an especially sensitive time for pregnant women and for their babies. Children are more vulnerable to pollution because their behaviors and interactions with the environment increase their risk of exposure. For instance, children eat more food, drink more water, and breathe more air per unit body weight compared to adults. They spend more time playing outdoors. They play in the grass and the dirt, close to the ground where pollution settles. Every parent knows they put everything in their mouths: dirt, rocks, toys, dirty hands and fingers, and food. Their rapidly growing and developing bodies are susceptible to damage from toxics, especially their brains and their immune systems. Also, children have a long shelf life, and that means that signs and symptoms of some diseases may not be felt for years or even decades after exposure to toxic chemicals and pollution. And we mustn't forget that the most important predictor of poor health in adults is poor health in childhood. By the same token, good health in children improves the chances for a healthy future. Elderly people and those of us who live with chronic medical conditions and disabilities are at risk. And people living at in low income and minority communities are more likely to be exposed to higher levels of fossil fuel pollution and have more health problems related to those exposures. People of color and indigenous Americans who often live in environmental justice zones close to polluting industries. They're also at higher risk of exposure and health impacts. Industry workers who are exposed to physical injury, air pollution, chemicals, and radiation may not have the personal protective equipment and training necessary to protect themselves and their families from harm. Workers who labor outdoors are at risk from the rising heat and extreme weather from climate change. And let's not forget our first responders who will bravely run into dangerous situations without full knowledge of the threats they are about to encounter. So, the long term health impacts from fossil fuel pollution and our never ending exposure to plastics and petrochemicals are pretty well known after several decades of occupational and community based research showing impacts from pregnancy to childhood and into adulthood, from the cradle to a premature grave. We know that tiny particles, toxic vapors, and synthetic petrochemicals that we are regularly exposed to can impair fertility, complicate pregnancies, and lead to poor birth outcomes. Birth defects and developmental delays lead to lifelong health burdens for young children, for their families, and for society. Lung cancer, bladder cancer, and other types of adult and childhood cancers are linked to fossil fuel pollution, which impacts practically every organ system in the body, not just the lungs, but also the heart and the brain and the liver and the kidneys. Recent research describes the links between fossil fuel and petrochemical pollution and the development of obesity and type 2 diabetes, dementia, anxiety, depression, and other forms of mental illness. And it's now estimated that nearly 9 million people worldwide die prematurely each year as a result of exposure to pollution. And that includes tens of thousands of Americans. Over the last 35 years, as plastics made its way into our lives and accumulated in the environment, there has been a corresponding rise in chronic diseases in the US and globally. Neurologic disorders like autism and dementia, cardiovascular diseases, environmentally sensitive cancers, especially in young adults, digestive disorders, obesity, and type 2 diabetes. Lower sperm counts in males and other reproductive impacts have also been documented during this period. It's probably not coincidental that the rise in chronic diseases in the US correlates with the fracking boom and the expansion of petrochemical and plastics manufacturing. In the past 35 years, since 1990, humanity has burned through more than half of all the fossil fuels ever extracted. More than 75% of all the plastic on this planet is also less than 35 years old. And you can see that the forecast for plastic pollution production, or for future plastic production, keeps rising, which means more fracking, making this a dangerous time to be a kid. So all of us are patients, right? How should we address our health concerns with our health providers? First, keeping a health diary can be helpful. List any symptoms that you are concerned about. Note whether the symptoms correlate with weather, and note any changes in the environment around you, like smelling unusual odors around your house, or any changes to the color, smell, or taste of your water. Let your provider know if you live near an industrial site or a heavily traveled road or highway. Make sure you come prepared for your visit. Bring questions. Remember, time is limited, so keep the questions brief and make sure you take note of the answers. Be patient with your providers and be honest. They may not be able to answer some of your concerns related to environmental triggers, but they are resources. There are resources that can guide them. When taking an environmental health history, providers can use the mnemonic I prepare to help cue them to ask specific questions and provide educational resources to their patients. First, investigate potential exposures. Ask about present work duties and any potential on the job exposures. Inquire about the patient's residence and the environment in which they live, in other words, their zip code. Discuss broader environmental concerns that might affect a patient's health. So a history of smoking and a dietary history would go here, as well as making sure your patient is prepared for extreme weather and heat as a result of climate change. Ask about past work and related job exposures. Inquire about hobbies and activities outside of work and home. Provide referrals and resources to help patients and educate patients on how they can minimize or prevent exposures to hazards. I know that health professionals today get very little, if any, training in environmental health, but they shouldn't feel alone when evaluating their patients. Some large hospitals have a medical toxicologist or two uh, to consult with and refer patients to. Occupational and environmental medical specialists may also be available for consultation. Of course, environmental and public health nonprofit organizations like Physicians for Social Responsibility Pennsylvania and Environmental Health Project are available to steer providers in the right direction and get them the information they need. Pediatric environmental health specialty units are available for consultation for health professionals and for patients, including parents and pregnant women. There are 10 regional units serving all 50 states, the District of Columbia, US territories, and tribal nations. Here in Pennsylvania, we are in Region 3, which is affiliated with the Villanova University's Fitzpatrick College of Nursing. This is a fantastic resource for providers addressing environmental health concerns in pregnancy and during childhood. I want to briefly plug an upcoming webinar from their Childhood Cancer and Environment program on December 8th on evaluating the impacts of the environment on pediatric cancer risk and survivorship. Until recently, the Pennsylvania Department of Health had been slow to recognize the need to educate health professionals throughout the Commonwealth on environmental health risks, but I am happy to report that things have markedly improved. The department wants to be a resource for providers who have concerns and questions about their patients' health and whether environmental exposures might be a factor. Their website is much more useful than it used to be. In response to environmental justice concerns, DOH created the Environmental Health Indicators Map showing where manufacturing, extraction, waste sites, transportation, and other polluting infrastructure are located, and who lives in those areas and how healthy those residents are. DOH is currently working to tack on a really cool feature where you can type in a patient's address, turn on a satellite view, and visualize potential environmental health threats from nearby industries, nearby highways, gas wells, and more. The Environmental Health Indicators Map can really help providers learn more about what's going on in their patients' zip codes. In January, DOH issued a Health Alert Network, or HAN, advisory with resources to help health providers assess the health effects of environmental exposures and respond to patient concerns. Every health professional in Pennsylvania should make sure they are signed up to receive these advisories, which are issued periodically to provide information and guidance on a variety of relevant clinical topics. It's important for providers to listen to their patients if they feel their health is being impacted by local industrial activities or other threats around them. They should feel encouraged to contact the Department of Health and speak with a staff member about any questions or concerns they have about their patient's care. Providers are encouraged to submit complaints to DOH on behalf of their patients if they feel their health is being affected by fracking. And patients can submit their own complaints as well, though it's better if providers are the ones who submit the complaints directly. I do recommend emailing and calling them and leaving a voicemail to ensure they receive the complaint. You should expect a response within a day or two. And if you don't get a response, resend your email and call again. Anyone having serious health symptoms um, should seek medical care, obviously, and they should seek it immediately. In 2020, a Pennsylvania grand jury harshly criticized the Department of Health for not being responsive to residents' health concerns around fracking. Since then, though, DOH has stepped up their game, and the leadership and the staff there really deserve a lot of credit. So I'm going to stop there. I want to remind everybody about the next in this webinar series on December 9th at 1 p.m. On healthy homes for healthy kids. And I'm happy to take any questions that you might have.
Thank you so much for that super in-depth presentation, Ned, particularly because I think it's that much more critical that we always link common environmental exposures to these adverse health outcomes that you amplified today. And as Ned said, we are going to transition to our Q&A portion. If you have any questions, please just raise your hand or put it in the chat and we will address them in order. I see, Carmen, you have your hand raised.
Thank you very much for a very informative webinar. You touched on a variety of potential environmental hazards. And I just wondered if you could make a few comments about any successful policies that have been created to address the harms of any of these toxins. And particularly, I live in Philadelphia, so not close to fracking, but given what you said, that the risk is proportional to distance from those sites, it would seem like we want to regulate how closely homes and playgrounds and schools are built to these fracking sites. So I was thinking, are there any policies that govern that, or how do we create such policies if we don't have any?
Thank you for the question. Look, I think creating policy in this state, especially, is very difficult when those policies are meant to protect health. In Pennsylvania, but also every state in the country, reducing or actually eliminating indoor smoking was a huge success for public health. Also efforts to decrease cigarette smoking has been very effective in lowering the risk of lung cancer and other cancers. There have been similar public health programs on alcohol, for instance, on nutrition to lower the risk of obesity, and so forth, that I think we're all aware of. But no, we're constantly fighting the battle of getting the attention of legislators and this governor, and we're finding it very, very difficult to get through all the noise that we hear when we do visit Harrisburg. And many of us in PSR Pennsylvania and other nonprofits here in Pennsylvania, we make periodic trips to Harrisburg to talk to our legislators, to talk with the governor. And it's very, very frustrating because it is obvious that the closer you are to this pollution, whether it's from an incinerator in Chester, or whether it's from a frack well pad in southwestern PA, it's really, really hard to get a policy changed to be health protective. So we just have to keep plugging. We have to keep making our argument. And that's hard to do in this country right now, but we still have to do it.
Thank you, Ned, and thank you, Carmen, for elevating the policy question. It's impossible to have any conversation regarding environmental health and the prevention of environmental cancer without talking about statewide policy implementation. So thank you so much for that. Ned, a question that I have is particularly around plastics. Every time I log on to work each day, I see news articles and research articles increasingly about plastics and exposure. Can you answer specifically, how can patients reduce their cancer risk from plastic production?
Yeah, that's a good question. And that's something that I'm spending more and more time on with PSNAP. Plastics is harmful from the cradle, from the fracked gas well, all the way to the cracker plant and beyond. Beyond to our polluted oceans and waterways, to our landfills. So Plastics can be harmful in a couple of ways. Just plastics themselves. When plastic breaks down over time into smaller and smaller pieces, those tiny fragments called microplastics and nanoplastics can enter the body through the lungs, through the gut, and they can cause problems. Researchers have found these tiny fragments, I think I mentioned, in every organ they look, in every tissue they look, and it appears to trigger chronic inflammation and cause cellular damage, uh, all while releasing the chemical additives, like a time release capsule releases its medication. There are over 16,000 different chemicals that are added to plastic. These are dyes and fillers, plasticizers, flame retardants. Uh, More than a quarter of these chemicals have been known to be hazardous. Less than 1% of these chemicals are not hazardous. Many chemicals added to plastics are carcinogenic, like PFAS, as I discussed, but also phthalates and polybrominated flame retardants. So the plastics can cause physical harm, and the additives, which, by the way, chemical additives make up more than half of the weight of plastics. They result in chemical harm. So to reduce the risk, um, use less plastic if you can. Be especially aware of single-use plastic in food and beverage packaging. Try not to use plastic food utensils, drinking cups, plastic bottles, and food containers that are made of plastic. Avoid styrofoam at all costs because it releases styrene, which is one of the most toxic chemicals that we know of and can cause cancer. Um, and use glass and stainless steel food containers and products. Those are much better options. Reducing demand, not just with food packaging, but also shopping bags and clothes that are made with polyester and nylon and other plastic components, synthetic textiles, etc., that are mostly made of plastic. Reducing demand is really important, but it can be hard to do. And last thing, whatever you do, if you don't do anything that I just mentioned, never heat your food up in a plastic container because that promotes the leaching of those chemicals into our food.
So reduction is the name of the game, and no heating is also the name of the game. Thank you so much.
Right.
Looks like we have time for one more question. Are there any other questions that our audience members have today for Ned?
Hello, I have a question. This is Krista Motley. We typically get pushback from the labor unions, and I'm always trying to figure out, how do we have conversations with labor unions where their primary goal is to put their members to work, and I'm just trying to figure out where, if any place, do they draw the line? Say like, I don't want that kind of job. Is that a thing? I'm the health commissioner for the city of Chester, and this is like, I have great relationship with the labor union, but they don't want to hear it. I'm like, so I'm always trying to figure out like, where do they draw the line? Anyone have any insight on that?
Thank you, Christy. I don't know. I think workers today want to be safe. They want a job, but they want to be safe. And I think there's lots of room for a conversation, but sometimes that conversation never gets started. So we need groups, especially nonprofits, to find a way to meet these workers and labor unions because we all want the same thing. We want good paying jobs, and we want our workers to be safe and their families to be safe. And unless we have these conversations, it's really hard to know exactly what working people want, what unions want. But I'll tell you what I want as a doctor is I want clean air for my patients, for everybody. I want clean water for everybody. I want healthy food for everybody. And as a medical provider, I'm not going to sacrifice. I'm not going to compromise on that. I'm just not going to compromise. But I think keeping health at the forefront of our conversations is really, really important. There's no job, in my opinion, that's willing to be supported if it directly harms me or you or my kids or your kids. And that's one reason why I am, very much against in my area, very much against having more fracking, because that just directly threatens the health of all of us living close to it. And that's not acceptable ever. And I'm not going to compromise on that. I don't know any health professional who would.
Thank you. I know I mentioned that this most recent question was the last one, but Rebecca Hamner just added a question in the chat, and I would love to hear your thoughts, Ned. She asks, what about microwavable safe plastics? Are those less dangerous but still dangerous? Specifically, steamed veggie bags, take-home meals from restaurants, likely in those black plastic containers, minute rice, etc. What are your thoughts on those?
So whenever you see something that says microwave safe, it's important to understand that it's not safe for you or your kids. It's safe for the packaging. In other words, the packaging is not going to melt in the microwave. It's not going to get distorted. But it means nothing. It has nothing to do with whether chemicals leach out, which they will if you heat food in a microwave container, and that will increase the risk in people who consume that food. So, microwave safe means safe for the container, not for the human.
Me too, Rebecca, me too. I want to just take some time to thank all of the attendees for joining us in this critical conversation today and this Q&A portion. And I would also like to extend deep, deep gratitude to you, Ned, for sharing your expertise and always being a champion of this work. Every time there is opportunity for a medical professional to speak, you always offer your time and expertise and patience, and it is always, always appreciated. So thank you so much. And before we end
Thank you,
today's
Andre,
call,
and thank you, everybody.
before we end today's call, Ned did emphasize this at the end of his presentation, but I do want to mention it again. I would love to announce our second webinar in our series, and we hope that you are able to join us on December 9th from 1 to 1:45 for our second webinar, Healthy Homes for Healthy Kids, presented by Michelle Nakaradi-Chapkis, the Executive Director of Women for a Healthy Environment. This session will explore how children are uniquely vulnerable to environmental toxics and how actionable steps to reducing environmental exposures can be implemented in the household. So please join us for that expert conversation, and we hope to see you on December 9th. And I will put the registration link in the chat. You can use that link to register for the webinar in December and for the rest of the webinars in the entire series. Thank you so much. Have a good day, everyone.
Thank you.